Stem cells are special cells in the human body that can simply replicate themselves. In addition, they can also become any one of the 220 different cells in the body, such as the brain, lung, heart, liver, kidney, or skin cells. Blood-forming stem cells are a special type of stem cell present in the bone marrow. They make red and white blood cells as well as platelets. Bone marrow transplantation is a process in which these blood-forming hemopoietic stem cells are collected from a donor and given to the patient via a blood transfusion. The bone marrow from the donor repopulates the bone marrow of the recipient. A bone marrow donor is typically a healthy volunteer, such as a sibling, parent, or an unrelated individual. Blood found in the umbilical cord can also be used. Regardless, there has to be a good match between the donor and the patient, based on a unique group of proteins present in the white blood cells called HLA matching. A good HLA match improves the chances for a successful transplant, promotes engraftment, and minimizes the risk of graft versus host disease. HLA unmatched stem cells from a donor will most probably be recognized as foreign, and the patient's immune system will reject them, indicating a bad match. HLA matched stem cells, however, will not be recognized as foreign, thus minimizing the chance of rejection. The greater the HLA mismatches, the more likely donor immune cells are to cause graft versus host disease, as shown here courtesy of Dr. Rakesh Goyal. A patient's body has to be prepared for the bone marrow transplantation. A patient's own bone marrow cells, which make abnormal blood cells, have to be killed partially or completely. This helps to create space for accepting the donated cells in the bone marrow. Killing or removing the old bone marrow cells is achieved by administering strong radiation-based medicines. It is called chemotherapy, and it has some unwanted side effects such as hair loss, ulcers in the mouth, and diarrhea. It also reduces the white blood cell count drastically. In a healthy individual, these white blood cells or lymphocytes destroy cells that are foreign to the body, such as bacteria and viruses, thus giving protection against serious infections. But the same immune system mechanism can attack the new donor cells as they are also foreign to the body, so the patient's immune system has to be suppressed in order to prevent it from rejecting the new stem cells from the donor. The combination of chemotherapy and the use of immunosuppressive drugs to prepare the patient's body to accept the donor cells is called conditioning. But the rest of the process is as simple as getting a normal blood transfusion. It does not involve any surgery, and there's no pain associated with it. After the blood transfusion, stem cells from the donor know where they belong, and they make their way to the bone marrow of the recipient. Gradually, donor cells start making new and normal blood cells, including red blood cells, white blood cells, and platelets. When white blood cells are once again seen in the blood, this is called engraftment, a sign that the transplant is successful. More importantly, newly formed red blood cells make hemoglobin similar to the healthy donor, no sickling anymore. Sickle cell disease is cured on a permanent basis.